Last class we have seen the drugs for herpes virus type of infections as well as also anti-influenza drugs. Now today we will be seeing anti-hepatitis virus drugs, both hepatitis B as well as hepatitis C. What are the drugs that are useful for hepatitis B and hepatitis C virus? And as you know, hepatitis B virus, it is a DNA virus, whereas C virus, it is an RNA virus. So, what the specialty of hepatitis B virus is that it will integrate in, so you can see it will, this hepatitis B virus DNA, it will integrate into the host chromosomal DNA. So that will cause permanent infection. So once hepatitis B infection is there, it is permanent, and it may end up in chronic hepatitis, then cirrhosis, hepatocellular carcinoma, etc. And it is the infection is permanent. Whereas in the case of hepatitis C, it is an RNA virus. It won't integrate into the chromosomal DNA, but it will cause chronic hepatitis. So it is it won't integrate into the this DNA. It only causes chronic hepatitis, but later on it also can cause cirrhosis and hepatocellular carcinoma. So that is the main difference between hepatitis B and hepatitis C virus. Then, so that is the hepatitis. So later on it can cause liver cirrhosis or hepatocellular carcinoma like this. And so for hepatitis B, we cannot eradicate the virus from the body. So the idea is only to suppression of the virus, so that it will, and the inflammatory response and the damaging properties of the damages that is happening in the hepatocyte can be reduced by giving drugs. So that is for hepatitis B. And so that the further development of cirrhosis and hepatocellular carcinoma can be reduced or it can be prevented. That is the only thing. We cannot completely eradicate the hepatitis virus B infection from the body, only suppression of the virus. And most experts opine that unless loss of efficacy or toxicity limits use, the nucleotide or the nucleoside anti-HPV drugs should be continued 6 months after seroconversion. Seroconversion means once the infection is over, the development of antibodies will be in the blood. So 6 months after seroconversion, till then we have to continue the anti-HPV drugs. That is the most experts, the opinion of most experts. So that is the treatment plan. Now we will come to the different drugs. There are new drugs, new names. It's existing names are there, but anyway we have to study it. Lamivudine, one drug is lamivudine. This drug you will see again when you study HIV infection. So I am not going into detail about lamivudine. It is effective against hepatitis B virus infection. Lamivudine. So you will see again when you study HIV, that is retroviral, antiretroviral drugs. Then next drug, it is Entecavir. So this is one of the most active and first line option for treating chronic hepatitis B. So the drug name is Entecavir. Okay. So this, what does it do? It inhibits the hepatitis B virus DNA polymerase after activation by intracellular proliferation, and it breaks down the HBV titer more rapidly as well as profoundly. So all these drugs, what I am going to tell about the hepatitis B virus infection, all these drugs, they undergoes intracellular activation, that is by phosphorylation, and after phosphorylation, it may be converted to either diphosphate or triphosphate. Then it will be inhibiting the hepatitis B virus DNA polymerase, and it will cause the chain termination of the DNA. That is the common action of all these drugs. So it will be repeated again. So once again, all these drugs, once they enter the cell, they undergo intracellular phosphorylation, that is by activation by intracellular phosphorylation. Then it will inhibit the HBV DNA polymerase and cause the chain termination. That is DNA chain termination, it will be causing. So thus it is having the antiviral action. So that is the number one, it is the Entecavir, and it is the first line option for treating chronic hepatitis B. Now, it is having anti-HIV activity also, and it can be given oral. Oral dosing is there and it is well tolerated. So Antiviral, remember the name Antiviral, it is the first line option. Now, next drug, it is Antiviral Disoproxy. Antiviral Disoproxy. Okay, Antiviral, it is the monophosphate analog of adenosine monophosphate. So it is a Antiviral, it is a monophosphate analog. Again, same mechanism. It is used for hepatitis B virus infection. So we will read this. On entering cells, Antiviral is phosphorylated to the diphosphate, which has good affinity for HBV DNA polymerase compared to, yes, one important point is that all these drugs, they have more affinity for the hepatitis B virus DNA polymerase compared to host cell DNA polymerase. That is one. So it is more specific for the virus specific. So viral DNA polymerase, it will be affected. And also say we can again see Antiviral itself get incorporated in the viral DNA, resulting in the termination of the DNA chain. So same action you can see for all the drugs. So first activation to its phosphorylated form, then it will affect the DNA polymerase, that is the viral DNA polymerase, and it causes the termination of the DNA chain. So it is effective for chronic hepatitis B, but what was the other drug? It is Antiviral. Antiviral is the first line option, whereas this is not that having that effect. It is a least active nucleotide analog against HBV. So it is not a first line drug. What is Antiviral Disoproxy? Okay. Side effects, it is only mild sore throat, headache, flu-like syndrome, etc. So Antiviral Disoproxy is the least active nucleotide analog. Now, next is Tenofovir Disoproxy fumarate, that is TDF. Tenofovir Disoproxy fumarate. So this is again like Antiviral, it is a monophosphate nucleotide related to adenosine monophosphate. Again, it is effective against hepatitis B virus as well as HIV. But one thing, it is since it is having low oral absorption, it is available as a step prodrug. So prodrug means the meaning is that once it is in the body, it will be converted to its active form. So disoproxy, Tenofovir Disoproxy fumarate, it is available as the fumarate. It is available as the prodrug. So what will happen in the body? It will convert it to its the active form, and it will be then phosphorylated. Then it will be inhibiting the hepatitis B DNA polymerase. So we will read this sentence. Due to very low oral absorption, it is used as a disoproxy ester prodrug. Tenofovir released from the hydrolysis of the prodrug. So prodrug is converted to its active form, tenofovir, and it is phosphorylated by the cellular kinases into tenofovir diphosphate, which preferentially inhibit the hepatitis B virus DNA polymerase and HIV reverse transcriptase. So same mechanism. So if you study the mechanism for one, it is effective for, it can be for all the drugs. So that is Tenofovir Disoproxy fumarate. Some more points about Tenofovir. So here also again I have repeating the affinity for the host DNA polymerase, it is very low. And also it gets incorporated in the viral DNA to cause chain termination. So same repetition. Tenofovir disoproxy, it is only incompletely but adequately absorbed after oral empty. And the side effects, all these drugs are having only less side effect, some nausea, vomiting, etc. And it is one of the first line drugs for chronic hepatitis due to hepatitis B. So the drugs we have seen, once again we will see the names: Lamivudine, Antiviral, that is the first line drug, Antiviral, then Antiviral Disoproxy, Antiviral, then Tenofovir Disoproxy fumarate. It may be difficult to remember the name. Anyway, try to remember it. Then Tenofovir Disoproxy fumarate. The mechanism, I think you understood. I have told. Then next drug, it is Telbivudine. So now we are talking about the drugs against hepatitis B virus infection. So the fifth drug, it is the Telbivudine. Telbivudine, it can also be given orally. Again, mechanism, it is same. It enters the cell and is phosphorylated by cellular kinases to generate the triphosphate nucleotide, which competitively inhibit the hepatitis B virus DNA polymerase and also get incorporated into the hepatitis B virus DNA, resulting in the chain termination. Same mechanism. Only the drug name you have to remember, telbuudine. And it is not. It is also not a first-line drug for chronic hepatitis B. And the tolerability, but the tolerability, it is very good. So as you have seen, Antiviral, it is the most active first-line option for treating chronic hepatitis B. And lamivudine also is there, but Antiviral is the most important drug. So Antiviral, Adifovir, Tenofovir, and telbuudine. Okay, so that was about hepatitis B. Once again, the drug name, lamivudine, Antiviral, which is the first line option, Adifovir dipivoxy, then Tenofovir disoproxy fumarate, TDF, then telbuudine. So these are the drugs for hepatitis B. Now we will see the drugs for hepatitis C. Again, many new names are there. You will be coming across many new names. And the aim of treatment for chronic hepatitis C is to attain sustained viral response. Sustained viral response, the meaning is undetectable, this hepatitis C virus RNA in the blood for at least 6 months after completion of therapy. So we will be giving the treatment 6 months after, after 6 months of the completion of therapy. If we check the blood, it will be, the HCV RNA should be undetectable. That is after 6 months after the therapy. That is called sustained viral response. So that is the aim of treatment for chronic hepatitis C. So we have to give the treatment, then we have to stop the treatment, and after 6 months again check if it is undetectable. HCV RNA, it is undetectable. That means it is a correct treatment. And if this is achieved, this sustained viral response, if it is achieved, only 5% patients will relapse with hepatitis C. And the most important and conventionally the standard therapy is actually oral ribavirin combined with injected PEG interferon alpha. This we will see in the last. So the most important treatment, the best treatment, it is oral ribavirin combined with an interferon, that is PEG interferon alpha. This is the best treatment for hepatitis C virus infection. That is the one that is used in India also. So the other drugs also we will see, but the best treatment is oral ribavirin with injected PEG or polyethylene glycol interferon alpha. So that is hepatitis C. So we will see one by one the drug that is ribavirin or ribavirin. It is a purine nucleoside analog, and it has it is a broad spectrum activity. So hepatitis C virus, that only we are dealing with now, and it is also effective for influenza A, B, respiratory syncytial virus, and also some other double-stranded RNA virus. Again, so this is now we are talking about hepatitis C virus. It is an RNA virus. So here this drug, they here also intracellularly its triphosphate derivatives will be liberated, and they inhibit the GTP synthesis and viral RNA synthesis. That is the mechanism for all these drugs, ribavirin. So it is again intracellularly activated by phosphorylation triphosphate, and that will inhibit the GTP synthesis and inhibit the viral RNA synthesis. Now, oral bioavailability, it is very good. All these drugs we can give orally. Now we will see the ribavirin. Many uses are there. One important use that we are now we are seeing, that is chronic hepatitis C. So I have already told it is given along with PEG interferon. It is for 6 to 12 months. That is traditionally that is the treatment for hepatitis C. Ribavirin with PEG interferon for 6 to 12 months. Then for the respiratory syncytial virus bronchiolitis, usually this happens in infants. For that, we are using a ribavirin. It is the nebulized version. We can give nebulization with ribavirin. This is for respiratory syncytial virus bronchiolitis. So the drug for respiratory syncytial virus bronchiolitis, it is nebulized ribavirin. Okay. Now, okay, so we have seen ribavirin. We are talking about the drugs for hepatitis C. So number one, it is ribavirin. Then interferon alpha. So what are these interferons? So already you have studied in pathology, microbiology, everywhere. You have studied what are the interferons. Interferons, they are low molecular weight glycoprotein cytokines produced by host cells in response to viral infections or tumor necrosis alpha or interleukin 1 and some other inducers. So whenever there is some viral infection from the host cells, this because of the viral infection, some proteins, glycoprotein cytokines will be liberated. So which is having some antiviral effect is happening in our body. So they are called interferon. They are low molecular weight glycoprotein cytokines. And they have many non-specific antiviral action, and it will inhibit the viral proliferation also. So we can see many effects are there. These interferons, what will happen? It can cause, it can affect the viral penetration. Sorry. It can affect the viral penetration, synthesis of viral mRNA, assembly of the viral particles, and their release. All the steps it can act interferons. But the most widespread effect is direct or indirect suppression of the viral protein synthesis, that is inhibiting the translation. So interferons, it can act at many levels, but the most important one is inhibition of translation. So the viral protein synthesis. So like that, the viral replication, it will be inhibited. So that is interferon. So, and these interferons, it will be acting through certain receptors. That is, you when you studied general pharmacology, you have studied many receptors, tyrosine kinase receptors, cellular receptors, then G protein coupled receptors, etc. So these interferons, they are acting through JAK, STAT, tyrosine protein kinase receptors. JAK and STAT. JAK, STAT, tyrosine protein kinase receptors. So these interferons, they will be binding with the receptors, and there will be phosphorylation. And once this JAK-STAT, it is phosphorylated, it enters the nucleus, and it causes the interferon induced proteins. And these interferon induced proteins only causing the antiviral effect. So that I am talking about the action of interferon. So interferons, it will be the receptors are JAK-STAT, and it will phosphorylate the cellular proteins and enters the nucleus and causes the interferon induced proteins, and that is responsible for the antiviral effect. So the receptor, it is JAK-STAT receptors. Then there are different types of interferons, human interferons. It is alpha, beta, and gamma. And another important point about interferons, it is host specific. So interferons that are produced by man, in man only it will be effective in man, but other species it is not effective in case of man. So that is some host specificity is there for interferon. Interferons are alpha, beta, and gamma. And there are two important interferons, interferon alpha 2A and interferon alpha 2B. They are actually produced by the recombinant technology now here, and it is clinically used. So it is host specific, and alpha, beta, gamma are there, and there is alpha 2A and alpha 2B. They are produced by the recombinant technology, and so these are given by intramuscular or sub-Q injections, and this pegylated or polyethylene glycol complex, the interferons, they are meant for subcutaneous injection, and after IM or sub-Q injection, interferon will be distributed into the tissues. So interferons, they are actually formed after some viral infection, and this host specific. There are different types: alpha, beta, gamma. Alpha 2A and alpha 2B. It is produced by recombinant DNA technology, and they are given by IM or sub-Q. Now we will see what are the uses of this interferon. So we are talking about hepatitis C. So it is used in chronic hepatitis C. It can also be used in case of chronic hepatitis B, alpha 2A. Then AIDS-related Kaposi sarcoma. This is the sarcoma that is usually happening in the AIDS patient. So interferon, it is useful in case of AIDS patient. That is a Kaposi sarcoma. Then condyloma acuminata, it is produced by papilloma virus. So if there is condyloma acuminata, usually it is treated with the podophyllin, but we can inject into the lesion, intralesionally, we can inject interferon, and that is used in the case of refractory cases. So chronic hepatitis B, C, number one, we are talking about C, then B, AIDS-related Kaposi sarcoma, condyloma acuminata. We are talking about the uses of interferon. It can also be used in case of herpes simplex, herpes zoster, and cytomegalovirus infection. And interferon will be added in case of cytomegalovirus infection. For this herpes zoster, we can add along with acyclovir. We can give, yesterday we have seen acyclovir for the herpes infection. So along with acyclovir, we can give interferon. Similarly, for CMV retinitis, last class we have seen ganciclovir. So along with ganciclovir, we can give interferon for cytomegalovirus infection. And interferons are also used in case of chronic myeloid leukemia, follicular lymphoma. So many cancers, cutaneous T-cell lymphoma, multiple myeloma. So we can see this skull multiple myeloma. Again, you have studied in pathology, all lytic lesions will be seen in the bone. So you can see all this black color, all the lytic lesion on the skull, everywhere on the bones it will have. That is happening in multiple myeloma. So multiple myeloma, many other anti-cancer drugs are there. Along with that, we can give interferon. So the uses once again, chronic hepatitis B, C, AIDS-related Kaposi sarcoma, condyloma acuminata, then herpes zoster, herpes infection, cytomegalovirus infection, chronic myeloid leukemia, follicular lymphoma, cutaneous T-cell lymphoma, multiple myeloma. So that is about hepatitis B virus, C virus. Now, yes, some adverse effects. So these interferons, they are contraindicated during pregnancy. The important adverse effects will be flu-like symptoms. So that will be there. Neurotoxicity may be there. Myelosuppression may be there. Thyroid dysfunction, whether it is hypo or hyper. Hypotension, transient arrhythmia, alopecia, reversible dysfunction. These are all, so especially flu-like and neurotoxicity and myelosuppression. These three, mostly it is seen. So these are the adverse effect of interferon. Flu-like symptoms, neurotoxicity, myelosuppression. Then these are all minor ones. Thyroid dysfunction, hypotension, reversible liver dysfunction, etc. At least you can remember flu-like symptoms and neurotoxicity and myelosuppression. So that was about interferon. And now again, some very new drugs, that is new direct acting anti-HCV drugs. So these are the latest drugs for the hepatitis C virus. So hepatitis C virus. So here where they are acting on the some specific non-structural viral proteins. Some non-structural viral proteins, and so thus causing the inhibition of the viral replication, non-structural viral protein. So these drugs act on the NS. NS means all the NS drugs will be having this letter NS. NS means it is non-structural viral protein. So we will see what are the drugs, which are the drugs. Newer drugs may be grouped according to their target NS protein. So there are different non-structural proteins in the virus. So they are actually NS5B, NS3, NS5A, or NS5A, NS5B, and NS3. So NS5B, non-structural 5B polymerase inhibitor. The name is, it's very maybe difficult to pronounce. Also sofosbuvir. So that is NS5B polymerase inhibitor. Then NS3, another non-structural protease inhibitor, Cymbrivir. Cymbrivir. Sofosbuvir, Cymbrivir. Then NS5A, 5A inhibitor, that is Declatasavir, Ledipasvir, and Velpatasvir. All funny names. Then Declatasvir, Ledipasvir, and Velpatasvir. There is no A here. Declatasvir, Ledipasvir, and Velpatasvir. So these are all latest drugs. So we'll just have some points about each drug. At least you remember the name NS5B polymerase inhibitor Sofosbuvir. NS3 it is Cymbrivir. NS5A it is Declatasvir, Ledipasvir, Velpatasvir. Okay, some points about these drugs. So NS5B polymerase inhibitor Sofosbuvir. So here also it will be this drug. It is a prodrug only. So it is converted to its triphosphate like other drugs. Triphosphate nucleotide and inhibits the. So first it will be converted to its phosphorylated nucleotide form and inhibit the non-structural protein. So NS5B. And it is nothing but it is a hepatitis C RNA polymerase. So NS5B. And similar to our drugs we have already seen, it will enter the viral RNA and serve the chain termination. So these drugs, usually it is given in combination, it is achieved this sustained virus response of 85 to 99% after 12 weeks of therapy. That is in non-cirrhotic, and in cirrhotic patients it is up to 93% after 24 weeks of therapy. Okay, so now it also can be given orally. Adverse effect, it is only mild abdominal pain, fatigue. So that is Sofosbuvir. It is the NS5B, that is non-structural 5B polymerase inhibitor Sofosbuvir. Okay, now NS3 or 4A protease inhibitor Cymbrivir. NS3 or 4A protease inhibitor Cymbrivir. So here again, it will be acting on this non-structural 3 protease and inhibit the viral replication. So like this, NS3 or NS4A. So you remember at least this one, NS3/4 protease inhibitor Cymbrivir. Then NS5A inhibitors. So in NS5A inhibitors, it will be which are the NS5A, Declatasvir, Ledipasvir, and Velpatasvir. Okay. So Declatasvir, it is orally active NS5A inhibitor which blocks the hepatitis C virus replication. So NS5A. So viral replication, it is terminated. So this is NS5A. There are 3 drugs, Declatasvir. So we are talking about the drugs for hepatitis C virus. So this is acting on the non-structural proteins. That is NS5A inhibitors, Declatasvir, Ledipasvir. So here Ledipasvir and Velpatasvir, it is found in it's a fixed dose combination. So this Ledipasvir, it is given along with this one, Sofosbuvir. It is a fixed dose combination. Fixed dose combination means in one drug or both the drug will be there. It is in a particular ratio. It will be there. That is Ledipasvir and Sofosbuvir and or LDV SOF. So there is a fixed dose combination. Similarly, Velpatasvir also, Velpatasvir and Sofosbuvir. So available only as fixed dose combination, Velpatasvir 100 mg plus Sofosbuvir 400 mg. So 2 fixed dose combination drugs which are the Ledipasvir with Sofosbuvir and Velpatasvir with Sofosbuvir. So once again we will see the names. It's very difficult to remember. Sofosbuvir. Maybe it is very easy for you. but for me it is very difficult. Sofosbuvir, okay. So that is number one, NS5E polymerase inhibitor, NS3/4A protease inhibitor is Symbrevir, NS3. NS5A inhibitors, three drugs are there, Daclatasvir, Ledipasvir and Velpatasvir. And two fixed dose combination drugs are there, that is Ledipasvir with Sofosbuvir and Velpatasvir with Sofosbuvir. I think that's all. Yes, that's enough.